When heart rhythm troubles surface, come to the Cardiac Arrhythmia Institute, a state-of-the-art practice. We not only medicate you, but cure you of your arrhythmia. Dr. Sidney Peykar is the Institute's founding physician. He is currently performing more cardiac ablations than the University of Florida, University of Miami, and University of South Florida.
At the Cardiac Arrhythmia Institute, Dr. Peykar and his staff got my life back on track.
For more information, go to fox4now.com and click on Health Now.
What was wrong with me initially, it started 6 years ago. It's called atrial fib, and that is when the heart beats out of rhythm. That heartbeat is disabling and sometimes causes you to even gray out, almost faint. It also takes vitality away from you and strength, and basically your heart feels like a dying fish flopping around in your chest, which is very uncomfortable. Prior procedure I had was done a year ago, and it failed me after the first year, and I was never taken off of medicines and only increased on medication. It was one of the reasons why I sought another ablation through Dr. Peykar, because of the fact that I was maxed out on medications and couldn't go any higher. And he was well recommended by my cardiac doctor. I had the ablation. Dr. Peykar took me off of all my heart medications. He did the procedure on me, and from that point on, I have had more energy and vitality and just a new lease on life. I really have appreciated what they've done for me, and it's enabled me to go back to work full-time in nursing.
I would either pass out or I was physically incapacitated. I couldn't do anything. I had heard his reputation was A1, and I had talked to other people who had gone through the procedure, and they were very satisfied with the outcome. So I went for it, and I'm able to swim again, and doing my housework. I can't lift boulders yet, but I'm getting there. And I'm very, very pleased with the hospital, the staff, and everything that the way I was handled as a patient. I think he's a wonderful doctor. He knows what he's doing, and I could highly recommend him.
At the Cardiac Arrhythmia Institute, Dr. Peykar and his staff got my life back on track.
Welcome to the Cardiac Arrhythmia Institute. I'd just like to take some time to go over our ablation procedure for atrial fibrillation and other arrhythmias. People ask me why I went into my field. It's one of the few fields in medicine that we can actually cure something. So the ablation procedure is a curative procedure, and depending on the arrhythmia, the success rates can be up to 98%. And we're able to cure these rhythms and give them a new lease on life, which has been very rewarding. The majority of the patients are very symptomatic with these arrhythmias. They feel lousy, and they've gone through the mill as far as medications to control it. The medications a lot of times make people feel worse. They're also at risk of stroke with atrial fibrillation and atrial flutter.
Palpitation can be cause for multiple medical problems related to heart rhythm abnormalities. One of the very common, especially in the elderly population, is atrial fibrillation. We are perhaps one of the only groups in the area that perform atrial fibrillation ablation for these medical problems.
Typically, the patients can expect an overnight stay for atrial fibrillation ablations. The procedure takes anywhere from 2 to 4 hours.
It's just a catheter inside the heart, and we try to look for where this rhythm abnormality comes from and try to treat it. There are some other causes of palpitation as well that can also be treated.
Since this is not a surgical procedure and we just access the veins, patients are usually back to doing their normal activity a few days afterwards. the procedure is done on a Thursday, they're usually back to work on a Monday. Both Dr. Estrada and I have sought additional training in Bordeaux, France, at the hospital Haute-l'Evêque, which is currently the world's best site for atrial fibrillation ablation. We've traveled there to learn the technique of the cure for persistent atrial fibrillation. So the cure for atrial fibrillation depends a lot on the technique utilized, and there are a few centers in the country, even academic centers, that provide the most up-to-date technique for the longer lasting, or also known as persistent atrial fibrillation. At the Cardiac Arrhythmia Institute, we not only treat your arrhythmia, but we cure it. Hi, I'm Dr. Sidney Peykar, founder of the Cardiac Arrhythmia Institute. Our practice's main focus is to cure abnormal heart rhythms, or arrhythmias. Today, we're treating a patient with atrial fibrillation. The most common symptom of this most prevalent arrhythmia is feeling tired or fatigue. A large number of our patients have felt that this is a result of aging, but in fact, it is related to their arrhythmia. The first part of this procedure involves getting access from the groin and the neck, which we do under direct ultrasound guidance to decrease complications. This procedure is done on a therapeutic Coumadin level. These are the sheaths that are advanced up to the heart, which are basically long straws, and the ablation catheter will be advanced through this inside the heart. Ablation catheter is just a long wire which has a radiofrequency tip, applies radiofrequency energy to kill the parts of the heart that will disconnect the veins that drain blood from the lungs to the heart. This will disrupt these aberrant impulses from reaching the normal heart tissue and stay inside the veins. A majority of our patients are able to come off medications, and also once they're in a normal rhythm, the risk of stroke is less. At the Cardiac Arrhythmia Institute, our focus is curing arrhythmias, not just treating it.
To learn more about the Cardiac Arrhythmia Institute, visit our website or give us a call.